300 million people worldwide suffer from depression.
And some novel therapies are changing the game when it comes to managing this often debilitating illness. Sofia Ojeda is reporting with more this morning.
Good morning, guys. There are some new treatments out there that folks may have never even heard of. And we've all heard of electroshock therapy. This new therapy is similar in that both treatments are used on the brain. Doctors say this newest magnetic therapy is non-invasive, can be performed at a doctor's office versus the hospital, and has far fewer side effects.
It's a disease that affects men and women, old and young, the rich and the poor. Depression doesn't discriminate, but there are ways to help control it. Talk therapy, along with antidepressant medications, have been the go-to treatment for years.
Medications are not 100%. They provide some options, but they have some limitations.
In fact, 1/3 of people with depression don't respond to antidepressants. And when the drugs do work, they can take 4 to 8 weeks to kick in. Doctors are now looking at other ways to help people when standard treatments fail. One method, called transcranial magnetic stimulation, or TMS for short, uses electrical stimulation to target areas in the brain that are underactive in people with depression.
What it does is it generates a very powerful magnetic field, which we can then target into certain parts of the brain to stimulate activity.
2 new FDA-approved drugs have also shown promise. The first, esketamine, is a nasal spray that acts within a couple of hours. It's derived from ketamine, which is used as an anesthesia during surgeries. Esketamine relieves symptoms in about half of patients with treatment-resistant depression. And brexanolone is a newly approved option for postpartum depression. It's given as an infusion over 2.5 days and starts to work within a few days.
The electroconvulsive therapy, also known as electroshock therapy, is another option still used for people with really serious treatment-resistant depression. It uses those electric impulses to trigger controlled seizures in your brains. But of course, there are risks, there are benefits. Talk to your doctor before you do it, before you sign up.
So many new things,
Especially
always.
if you're changing any treatment, absolutely.
Exactly.